Good morning. Have a seat. Last night, how many times did you get up to use the bathroom? And when morning came, did you feel like you had barely slept at all? Here is something worth knowing right away. Waking up to pee does not always mean your bladder is what woke you. Sometimes something else pulls you out of sleep first. Noise, discomfort, a racing mind, or a partner's snoring. Once you are awake, the bathroom can feel like the natural next step. That is a different pattern from a bladder that wakes you with a strong urge, even though the two can feel almost identical in the moment. Someone might say, "I'm up 3 or 4 times every night. Is this simply part of getting older?" It does become more common with age, but that does not mean you should automatically dismiss it as just another part of getting older. Your own pattern matters. So think back to last night. Did the urge to urinate wake you? Or did you wake for another reason and then decide to use the bathroom because you were already awake? If a strong urge pulled you out of sleep, your bladder or your body's urine production may be part of the story. But if you were already restless, uncomfortable, or fully awake before you thought about the bathroom, something else may be disturbing your sleep first. In that situation, focusing only on the bladder may leave part of the problem unexplained. That is the first clue I want you to remember tonight. What woke you first? Now let us look at the next clue. When you do get up, how much urine do you pass? Only a small amount, a normal amount, or a surprisingly large amount for one trip? Frequent small amounts can fit a different pattern from repeatedly producing a large volume of urine overnight. That detail does not diagnose anything by itself, but it gives your healthcare provider useful information. Then think about the hours before bed. Do you drink a large glass of water right before lying down? Do you have coffee or tea late in the day? What about alcohol with dinner? And if you take a water pill for blood pressure or swelling, what time do you take it? None of this means you have done anything wrong. These are ordinary contributors that people often overlook. I am not suggesting that you drink less throughout the day. Staying hydrated still matters. The goal is simply to shift larger drinks earlier, so your body is not processing them right as you are trying to sleep. And if you take a prescription diuretic, do not adjust the timing yourself. That is a conversation for the clinician who prescribed it. So your second clue is simple. Notice how much you pass and think about what happened before bed. Now ask yourself whether any other urinary symptoms show up. Do you feel sudden urgency, burning, or pain? Has your urine stream become weaker? Do you have trouble getting started? Is there dribbling afterward? Or do you feel as though your bladder never fully empties? These can fit several possible patterns: an overactive bladder, urinary irritation or infection, or in men, an enlarged prostate. That does not mean every man over 50 has a prostate problem. And this is not only a male concern. Women experience bladder and pelvic changes too. No single symptom confirms a diagnosis. The overall pattern simply helps your healthcare provider decide what should be checked. Pay attention to whether these changes came on suddenly or gradually. A sudden change, especially with burning, fever, pain, or blood in the urine, deserves faster attention than a symptom that has developed slowly over time. But even gradual symptoms are worth mentioning if they keep disturbing your sleep. This is also a good moment to think about constipation. If it has become a problem, mention it. Constipation can sometimes worsen urinary symptoms. You do not need to solve the cause yourself. Your job is simply to notice the pattern clearly enough to describe it. Now let us look beyond the bladder. Do you snore loudly? Has anyone noticed that you gasp, choke, or briefly stop breathing during sleep? Do you wake with a dry mouth or a morning headache? And are you tired during the day, even after spending enough hours in bed? For some people, a sleep-related breathing problem may be an overlooked part of the pattern. It is not proof of sleep apnea, but it is worth mentioning to your healthcare provider. If the pattern fits, they may recommend a sleep study. Now think about a few whole-body clues. Have you been unusually thirsty? Are you passing large amounts of urine during the day as well as at night? Do your ankles look puffier by evening? Are you more short of breath than usual? These clues can sometimes relate to blood sugar or to conditions that affect how the body handles fluid, including certain heart or kidney problems. That does not mean you should assume the worst. Swollen ankles alone do not mean heart failure. Thirst alone does not mean diabetes. What matters is the full pattern, together with your medical history. This is why a careful consultation is more useful than guessing from one symptom on its own. Here is what I would like you to do tonight. When you wake, pause before getting out of bed. Notice what woke you first, then notice whether you passed only a little urine or quite a lot. Write those details down for a few nights, with what you drank and when. That short diary gives your healthcare provider a useful starting point. Keep the bathroom path clear and well lit. If you take a water pill, ask the prescribing clinician whether its timing should be reviewed. Do not change it on your own. If the trips disrupt your sleep, your stream is getting weaker, or the problem is worsening, talk with your primary care doctor. Blood in the urine, burning or pain, fever or chills, new pain in your side or lower abdomen, unusual thirst with large urine volumes, or swelling that appears quickly deserves prompt medical evaluation. If you suddenly cannot urinate and you are in severe discomfort, seek emergency care. For chest pain, severe shortness of breath, fainting, or sudden confusion or weakness, call 911. Tonight, remember two things. What woke you first, and how much urine did you pass? For more calm, practical health conversations after 50, you are welcome to subscribe. Take care of yourself, and I will see you in our next video.